All right, this week, Chapter 7, the male reproductive system. How fun. The overall function or purpose of the male reproductive system is to produce, sustain, and transport sperm, which is the male reproductive germ cell, which is needed for procreation, provides half of the DNA needed. The other half comes from the mom in order to make an embryo and eventually a fetus and have a child. Also, the male reproductive system contains glands that secrete hormones like testosterone that give a male characteristics. All right, so organs of the male reproductive system, we have a list here, external and internal. We'll start with the external. The penis is the male organ of urination and coitus or sexual intercourse. Scrotum is a sac that contains the testicles or the testes and their corresponding epididymis and vas deferens. The testes are two oval-shaped circular organs that sit inside the scrotum. They produce sperm and testosterone. And the vas deferens is a tube that carries sperm from the testicles and the epididymis to the urethra to be ejaculated during sexual intercourse. You see vas deferens is listed on external and internal. The first portion of the vas deferens is external because it's within the scrotum, and the rest of the vas deferens is internal because it travels up into the urethra inside the body. The seminal vesicles are two accessory glands located at the base of the bladder that open into the vas deferens, and they secrete thick fluid, which is part of semen. And the prostate gland is a walnut-shaped gland that encircles the proximal section of the urethra and secretes fluid that helps move sperm during ejaculation. So fluid that is also a part of the semen. What we have here is a mid-sagittal view of the male reproductive system with some illustration and labels, so help us understand the parts that we're talking about, medical terminology that we're talking about. Down on the bottom, the testicles, epididymis. You'll have the vas deferens, which is the tube traveling from the vas deferens or from the epididymis up around over the bladder through the seminal vesicles, prostate, urethra. You have your external genitalia, your penis, your glans penis, which is the head of the penis. Prepuce or foreskin, it's the skin covering of the glands. Not all males will have this. Some of them have it surgically removed, which is known as a circumcision. This is a pretty good image picture overview of the male reproductive system. Here's another image of kind of the life cycle of sperm. It's produced down here at the bottom in the testicles, the testes, the seminiferous tubules specifically within the testes. Spermatogenesis takes place, the sperm, then you see the arrow transported to the epididymis where it can live, it can be stored, it matures, and then when ready, it'll travel through the vas deferens if you follow those blue arrows through the seminal vesicle, through the prostate gland, through the urethra, and outside of the body. More anatomic structures and some combining forms. Testes is plural for testicle. Combining form orcho, orchio, orchido. Seminiferous tubules are the tubes inside the testicles where sperm is produced, spermatogenesis. Sperm, combining form sperma or spermato. This is the microscopic male germ cell. The reproductive cell. So during sexual intercourse, sperm is ejaculated in semen or seminal fluid and can enter the female reproductive system and combine with an ovum, and they will together form a zygote, which will turn into an embryo, which will turn into a fetus, which will turn into a baby eventually. The epididymis, combining form epididymo. This is the structure that sits on top of the testicle. So after sperm is produced inside the testicle, it is next transported to the epididymis, where it can live,
Here
mature, or be transported out during sexual intercourse.
Here are
Vas deferens we talked about. It's the tube that transports sperm
here are
up into the urethra to be combined with seminal fluid. Seminal vesicles combining form vesiculo.
Here are some.
Talked about what these are already. Prostate gland combining form prostato. And then glans penis combining form balano. The glans penis is the enlarged tip of the penis. Some combining forms you'll need for this male reproductive system chapter. Andro, combining form for male. Cysto, bladder. Crypto, hidden. Vaso is vessel or duct. I skipped the prefixes, which we normally do, because there wasn't anything new. There was a few of them, and they were all things that have been covered in previous chapters. Suffixes, the suffix algia means pain. The suffix ia, diseased or abnormal state. Lith, stones or calculus. Rhea is discharge or flow. Plasia means formation, development, or growth. Disease and disorder terms, there are quite a few in the book, so read through the chapter. This is a little highlight of some of the ones that I thought were important or interesting. Anorchism, and without orchism, testes, right? Absence of testes. Balanitis, inflammation of the glands, penis. Ballo means glands. Benign prostatic hyperplasia or benign prostatic hypertrophy, overgrowth of the prostate. This typically causes problems with sexual dysfunction, ejaculation, more affecting urination. So difficult, painful, scanty urination, decreased flow, more frequent urination. So older adults will get benign prostatic hyperplasia, and this will cause problems with urination. They're up all night going pee. Benign means that it's non-malignant, so it's just like overgrowth or a tumor or something that's not spreading, not going to cause like a systemic cancer. Cryptorchidism. Crypto is hidden. So hidden testes. This is a testicle that has not descended from the abdomen. So it's stuck somewhere up in the abdomen, sometimes pretty far up. And this can cause problems with that testicle, more incidence of cancer in that testicle, possible decreased functioning, sometimes hormonal imbalances. Epididymitis, inflammation of the epididymis. So that structure on top of the testicle that houses the sperm can become swollen, painful, infected. Hydrocele is a fluid sac around the testes, same thing, swelling and pain, typical signs and symptoms. Priapism is a persistent abnormal erection. It can be caused by medications or injuries. Typically, this is painful. Testicular torsion is a twisting of the spermatic cord. So the blood supply gets cut off to the testicle. Signs and symptoms will be extreme, sudden onset pain. This typically happens to like puberty, aged males, and men in their teens and 20s. Just a sudden onset of severe pain in the testicle. Do an ultrasound, you can see that spermatic cord is twisted. They're not getting blood supplies. Medical emergency. They need to go to surgery to have this fixed as soon as possible in order to prevent losing their testicle. Surgical terms from this chapter: orchiectomy, excision or removal of the testes, testicle, bilateral, unilateral. Prostatectomy, excision or removal of the prostate. Vasectomy, bilateral excision of the vas deferens. Vaso means vessel or duct, but when they're talking about a vasectomy, they're almost always talking about the vas deferens, and it's a procedure done to make a male infertile. They'll take a section of the vas deferens out so sperm can't travel through the regular route to be expelled during ejaculation. Circumcision is surgical removal of the foreskin or prepuce. Transurethral resection of the prostate or TURP is a procedure where they remove part of the prostate that is overgrown in order to relieve signs and symptoms of benign prostatic hyperplasia. They'll use cutting of this prostate gland. They insert a device through the urethra, through the external meatus, the urethra, all the way up into the portion of the prostate, and they'll remove sections of this prostate. Diagnostic terms from this chapter: transrectal ultrasound is ultrasound using sound waves to visually examine an internal structure. They put the ultrasound probe through the rectum. Typically, they're looking at the prostate. Prostate specific antigen is a blood test where they can test this antigen present in your blood, which is elevated with men who may have prostate cancer. Semen analysis. So they'll take a semen specimen and they'll analyze it to see how much sperm, how active the sperm is, how viable the sperm is. It's a fertility test. Total testosterone is a blood test where they're testing the hormone testosterone. This can be indicative of problems with the testicles producing testosterone, either high or low amounts. Digital rectal exam, the doctor uses his finger to physically examine the prostate through the rectum, so they can feel if the prostate's overgrown or enlarged through the rectum. Complementary terms: aspermia, without sperm or without semen. Oligospermia, scanty sperm. So typically this person will have a sperm analysis and they have very few or very active or very few viable sperm. Oligospermia. Chlamydia is a bacterial sexually transmitted infection. Genital herpes is a viral sexually transmitted infection. Gonorrhea is a bacterial sexually transmitted infection. Human immunodeficiency virus, or HIV, is a viral sexually transmitted infection. Also bloodborne, can be transmitted through like IV use, drug use, blood transfusion, things like that. Human papillomavirus, HPV, is a virally sexually transmitted infection that can lead to genital warts and some forms of cancer. Syphilis, sexually transmitted bacterial infection. The good thing about all of these bacterial sexually transmitted infections, they can be treated with antibiotics. The viral infections are more difficult to treat and most likely lifelong permanent infections. And lastly, abbreviations: DRE, digital rectal exam; PSA, prostate specific antigen; TURP, transurethral resection of the prostate. This chapter has a lot of good stuff. Get going, read the chapter, do the exercises in the book, and then move on to your assigned exercises and quizzes. And let me know if you have any questions. Thank you.